Good afternoon again, everyone. Thank you for joining us. So, NCBA, the National Caucus and Center on Black Aging, welcomes you to our webinar on how to better manage your diabetes, presented by Keisha Lewis of Weldom, LLC. Ms. Lewis is a practicing occupational therapist and a certified diabetes care and education specialist with more than 17 years of experience working in the fields of human services, mental health, and physical disability. She serves as a consultant with the Health and Wellness Program for NCBA. In 2019, Keisha co-founded Weldom LLC, an aging in place consultancy. Keisha's ultimate focus is empowering individuals with the skills they need to be independent in their environment without fear. Thank you for joining us, Keisha. We appreciate you, and I'll turn it over to you. Thank you.
Thank you, Ms. Tellisford. Hi, everyone. Thank you for tuning in today. We'll discuss Diabetes Unlocked. And so we're going to go ahead and get started for strategies for success. So just to tell you a little bit about me, I'm Keisha Lewis, and as Ms. Tellisford mentioned, I'm a diabetes educator and an occupational therapist. And at Weldom, what we do is we aim to build healthier communities by preventing health complications and promoting independent living. Our focus is we bring personalized diabetes self-management services and aging well services directly to where our clients live, work, and gather. So as she mentioned, our focus is on empowerment and education in the community. So the next question I have for you, and you can answer in the chat, but if you had to take a guess, how many people do you think were diagnosed with diabetes in 2021? And just really quick, and I'm gonna look, would you think is A, 30 million, B, 15 million, C, 38 million, or D, 28 million? Let's see. What do you have in the chat? Okay, I see C, okay. A few more, I'll take a few more. Tell me what you think. Okay, so C, okay. So actually, now we're gonna see what the answer is here, okay? And the answer actually is C. It's 38 million people were diagnosed with diabetes in 2021. So thank you for engaging in that with me. So diabetes is a public health concern. And I want you to raise your hand in the chat or just say in the chat if you know someone that has diabetes. And let me see how many people know someone that has diabetes. And you can just hit yes. Yes, yes. Yes. I see yes, of course. Yes, several. Okay. All right. So it's true. Most of us know someone that has diabetes, whether it's type 1 or type 2 or gestational diabetes, in which we'll talk about. But there's a new statistic that tells us that every 17 seconds, someone is actually diagnosed with diabetes. Diabetes is the 8th leading cause of death. And in older adults, the CDC recently stated that 16.5 million adults over 65 have diabetes, and another 27.2 million have prediabetes. And over the next decade, we expect that diabetes will increase in the older adult population as well as the general population. So truly, diabetes is a concern. Now I have another activity, and this is important for me to introduce you all to, but this is the American Diabetes Association has a 60-second risk assessment to know your risk. And so I'm going to ask, and I'm going to set my clock, and 60 seconds we're going to take to do this. But if you have your cell phone, you can either scan the QR code that's on your screen, or Ms. Tellisford, I'm going to ask you to put that link in the chat to know your risk. And I want everyone on the call just to take 60 seconds, and I'm going to start my timer. And I'd like you to give it a try, and I want you to see what your risks are and if you've been identified. So Ms. Tellisford, thank you for dropping that in the chat. If you could drop that link in the chat. And I am going to start my timer as soon as you drop the link. There you go. All right. So I am going to give everyone 1 minute, and the timer is going to start now. So please scan that QR code, or please click that link and do that 60-second assessment. And then when the timer stops, I'll go on to the next slide. But I want you all to know your risk when you leave this call today, or know the risk of some of those that you love, to be able to encourage them to go to this site and take the 60-second risk assessment. So we've got 32 seconds left. And at the end, you don't have to share what your risk was. This is just for your general information. 14, 13. All right, here we go. We're on the stretch. All right. Time is up. Okay. Thank you for engaging in that activity with me. When you finish, if you've identified yourself as someone as being at risk for diabetes, I want you to follow up with your doctor, and I want you to have a conversation about getting tested. And we'll talk about some of those tests or screening later. So for diabetes risk factors, according to the American Diabetes Association, the following are all risk factors associated with diabetes. So being overweight, having a waist circumference in women, men over 40, and for women over 35, long periods of physical inactivity, having a history of smoking, having a family history of diabetes, being over the age of 45, certain ethnic groups, having gestational diabetes or having delivered a baby weighing more than 9 pounds, and then abnormal cholesterol and blood pressure readings. So again, according to the American Diabetes Association, these are some of the risk factors associated with diabetes. So then we know the risk. So now we're going to talk about when should we be screened for diabetes or pre-diabetes. So again, all of these screening criteria are based off of the American Diabetes Association. And so the criteria is if you're overweight or you're obese and you have a BMI of greater than 24, or you're Asian American individual and you have a BMI of over 23, and you have one or more of the risk factors that listed on the right side, this puts you more at risk for developing pre-diabetes or diabetes. So I'm just gonna take a moment and I'm gonna have you look at the list, but these slides can be available to you after this presentation. And then again, other risk factors that we have listed here. And these I'm going to highlight. So if you've ever been told you had pre-diabetes or you had impaired fasting glucose, you're more at risk for diabetes or pre-diabetes. If you were ever diagnosed with gestational diabetes, you should have lifelong testing at least every 3 years for diabetes. And then for all people, once you reach the age of 35, you should begin getting screened for diabetes risk. And then if the results are normal, testing should be repeated at a minimum of 3-year intervals. And another class of individuals is people with HIV should have a screening done for prediabetes and diabetes. And then you might ask, well, how often should I be screened? If I get screened this year, when should I be screened again? So screening criteria, if you've been told you have prediabetes or impaired fasting glucose, you should receive that screening yearly. If you have a history of gestational diabetes, meaning you had diabetes when you were pregnant, that's at least every 3 years. And then if your screening is normal, then you follow up with your doctor and you request a screening a minimum of every 3 years. So I mentioned the term pre-diabetes a couple of times in our slides already. So what does pre-diabetes mean? So pre-diabetes is actually a condition that can lead to type 2 diabetes. It's when an individual's blood sugars are higher than what's considered to be healthy, but not high enough to be considered type 2 diabetes. So if you have been told you have pre-diabetes, how did the doctor identify that? That's important to know. Or how will you know if you have pre-diabetes? So if you went to the doctor and you had some fasting blood work done, and your blood sugars fasting ranged between 100 and 125, that's enough to tell the doctor you have impaired fasting glucose, so pre-diabetes. Another test that the doctor may do to determine if you have pre-diabetes is if you get a hemoglobin A1C test. And that hemoglobin A1C test, what it does is it measures the amount of sugar that's been attached to your red blood cells over a 90-day period of time. And so if that hemoglobin A1C falls somewhere between 5.7 and 6.4%, that indicates that you're in that range of pre-diabetes. Now we move into what is diabetes. So diabetes, it's a chronic condition and it occurs when someone's pancreas doesn't produce enough insulin, or the insulin that someone is producing, their cells become resistant to the insulin. So either way, it's a dysfunction and a decreased amount of insulin in individuals. And then uncontrolled diabetes can lead to heart disease, stroke, kidney failure, blindness, and lower limb amputations. So it's really important to know your risk and be able to identify those risks because we want to prevent these complications from happening. So the types of diabetes are type 1 diabetes, and in type 1 diabetes, the pancreas is no longer producing insulin. And then we have type 2 diabetes, and in type 2 diabetes, the body does not produce enough insulin or the insulin has become resistant. And then we also have gestational diabetes that often occurs during pregnancy. So what are some of the symptoms of diabetes? So some of the symptoms that you might experience if you have diabetes could be frequent urination, frequent thirst, extreme hunger, extreme fatigue, blurred vision, or cuts or bruises that are slow to heal. Now, I will mention to you, some people don't have any of these symptoms. They just end up with elevated blood sugars and they end up going to the ER sometimes. But these are some of the symptoms that you might experience. So if you have been experiencing some of these symptoms and you took that risk assessment and you've identified that you are at risk, then I encourage you to go speak to your doctor. So I've got another question and some time for some engagement in the chat. So how is diabetes diagnosed? We're going to talk about that. But give me your best answer of what you think. Do you think it's A, the fasting blood glucose test, B, the hemoglobin A1C, C, the oral glucose tolerance test, or do you think it's all of the above? Let me look in the chat. D. All right, looks like the overwhelming majority thinks the answer is D. So let's see. The answer is D. It's all of the above. So we're going to talk about that next. But with diabetes, there's lab values that the doctor may order to determine if you have diabetes. And so I'm going to go over someone that does not have diabetes, what pre-diabetes looks like, and then diabetes. So someone with normal blood sugar levels, their fasting blood sugar, let's say I go to the doctor, I get my physical, my fasting blood sugar should be less than 100 if I do not have diabetes. My hemoglobin A1C would be 5.7% or less. And if I took that oral glucose tolerance test, which this is a test in which you drink a really sweet, syrupy substance. And then after, they measure your blood sugars. So less than 140 if I don't have diabetes. Now we move into the range of pre-diabetes. So pre-diabetes is when that fasting blood sugar falls between 100 and 125. The hemoglobin A1C falls between 5.7 and 6.4%. Or you do an oral glucose tolerance test and it's between 140 and 199. And then diabetes is diagnosed when that fasting blood sugar reaches over 126 or greater, I should say. When the hemoglobin A1C reaches 6.5% or higher, or when the oral glucose tolerance test is 200 milligrams per deciliter or higher. So these are some of the lab values that your doctor used to diagnose diabetes, okay? Is there a question? Okay, no. Okay, there. And I'll get to your questions, I promise. I just saw a question I thought in the chat, but I'll get to your questions about this. The other thing I want you to know about these lab tests is that when your doctor performs one of these tests and they determine, okay, you have diabetes, the doctor will perform they will perform two tests. So you may first get the fasting blood sugar done and it's over 126. Then typically the doctor will perform a second test to verify that. So that second test could be another fasting blood sugar, or it could be another hemoglobin A1C test. Or they could use a hemoglobin A1C and a fasting blood sugar. But it takes two tests to determine the diagnosis of diabetes. And one of the things I always tell clients is once you know that you have diabetes, it's very important to know what was the number when you received your diagnosis. So was it your fasting blood sugar that determined that number, or was it your hemoglobin A1C? You need to know that number because you need to know what to work on to improve, okay? Oops, let's see there. All right, so why am I so concerned about diabetes and complications? So I'm going to answer this question. So if you have diabetes and you have decreased insulin production and you have insulin resistance, then that means that that sugar that you need for energy isn't getting, to your cells. And so what happens when glucose can't get into cells to be used for energy? That glucose builds up into harmful levels in your bloodstream. And over time, this can cause damage to your organs, nerves, and vessels. So you see the little picture there on the left-hand side. And that picture is showing you, basically that's like a picture of your digestive tract there. And so when you eat food, that food is broken down and it turns to little molecules of sugar, those little bluish specks you see. And what happens is then you see your pancreas down here. And your pancreas's job is to release insulin, which is this green stuff that it looks like it's releasing. Okay. Insulin's job, I always tell people, is to act like a key. It unlocks the door to your muscle cells, your liver cells, and your fat cells, and it allows that sugar to flow in. If you're not making enough insulin or your cells have become resistant to insulin, guess what? The sugar can't get in the cells. So that sugar has no place to go. So the sugar stays in your bloodstream and it backs up and it causes harmful levels in your bloodstream. And over time, that's why you have some damage to your organs, your nerves, and your vessels. So when we think about diabetes complications can affect every part of your body, but this doesn't have to happen. And I tell people it doesn't have to happen because we can do things about it to prevent those complications. But when diabetes is not managed, complications can occur. And these complications can cause heart attack, stroke, it can cause retinopathy or blindness. It can cause neuropathy, which is nerve damage. It can also cause kidney failure. And it's important to mention that older adults with diabetes, they have higher rates of functional disability. They have higher rates of muscle loss and coexisting illnesses like high blood pressure, kidney disease, heart disease, compared to those that don't have diabetes. And particular attention should be paid to those complications that can occur over a short period of time. So visual complications or lower extremity complications, like you might develop a wound on your foot that might lead to a bigger complication over time, like an infection that can lead to an amputation. So as I interact with my clients with diabetes, it's really important to help you identify, it's important to get screened for these complications. It's important to have conversations with your doctors about how to manage these complications. So now you might be saying, okay, I've identified I'm at risk for diabetes, or you might be on the call because you have diabetes and you want to know, well, what steps should I take to avoid complications? So we're going to talk about that next. So diabetes self-management education and support services, known as DSMES. It's really important to identify someone to seek out for diabetes education. So the times that the American Diabetes Association has identified is at diagnosis, annually when you're not meeting your target. So let's say you follow up with your doctor, you're not meeting your goal ranges for your blood sugars. You need to see someone. When complicating factors occur, that might mean, okay, I have diabetes and now I've had this other problem where I have decreased sensation in my feet. Okay. Another time is when transitions in care occur. So let's say I've recently been admitted to a hospital and now I'm coming out of the hospital because maybe I had pneumonia and my blood sugars are not well maintained and I need to talk to the doctor and I need to seek some diabetes education services. So that's another thing. These are times that you need education. So if you've never received diabetes education and you have diabetes, I want you to advocate for yourself and I want you to ask your doctor. I want you to say, hey, I've never had diabetes education and I heard it was a program that I could participate in, and find out and have your doctor refer you to someone to provide some education. So the steps that we take to prevent diabetes complications, there's these 7 areas. We call them the 7 areas of healthy behaviors or health change. So healthy eating, being active, healthy coping, problem solving, risk reduction, monitoring, and taking medication. So these are all things that we can do to prevent complications of diabetes. And so what I'm going to do next is I'm going to break this down a little bit more, and I'm going to give you some examples of each and what you can do. So the first thing we're going to look at is healthy eating. So what can we do to change our normal habits? So promoting healthy food choices. What does healthy food choices look like? So here I would recommend, again, seeking out diabetes education or working with a registered dietitian to help determine what's healthy food choices and what's healthy patterns of eating. And then the other thing that you can do is you can learn carbohydrate counting and portion control. So what does that look like? Identifying what carbohydrates are and identifying how much I should have on my plate are key to that. And again, I encourage you to seek out a diabetes educator or a dietitian to help you with that. Being active. What do I mean by that? So being active is I want you all to incorporate at least 30 minutes of physical activity into your daily routines. So that's really important. The American, the College of Sports Medicine and the CDC, they recommend at least 150 minutes of physical activity on 5 or more days out of the week. And I always tell people, so that's 30 minutes, 5 days a week, and you'll hit your goal. But then some people tell me, well, Keisha, I can't really do 30 minutes of physical activity. And I say that's okay. Because guess what you can do? You can break that 30 minutes up. If you decide I'm going to walk 10 minutes in the morning after breakfast and 10 minutes in the evening after lunch and 10 minutes in the evening after dinner, then guess what? That would still be 30 minutes over the course of the day. You're still going to get a cardiac benefit. You're still going to get a benefit for lowering your blood sugars. So just take a step and try to incorporate that activity. And then what does healthy coping mean? Healthy coping means working to manage stress and developing coping strategies. So I always say with diabetes, you don't get a day off from managing your diabetes. And at times that can get really frustrating. So developing strategies of talking to your doctor about easier ways to manage it, or talking to your educator about how to help me get through this, or working with your other healthcare providers about strategies and techniques to be able to cope with testing your blood sugars or these changes that we're recommending in your eating habits and routines. And then we have problem solving. So problem solving is learning strategies to be able to take your blood sugars. Sometimes clients might tell me, I can't get enough blood out of my fingertips. And so what that might mean is I tell them sometimes just run some warm water over your hand, or maybe, try this technique. So there's different techniques that you can try that individuals can problem solve together. And then also a problem-solving technique might be learning meal prep techniques and strategies. So for clients that say, hey, I don't have time to cook during the week, um, you know, I eat fast food all the time, then we're going to problem solve and we're going to say, hey, you know what? Maybe try meal prepping over the weekend. Cook enough food so you can have for different days out of the week. So that's a strategy and problem solving. Then we move over to risk reduction. So with risk reduction, what you can do is participate in education to reduce your risk of complications. So again, asking your doctor, looking online with programs for diabetes education to help you out. Schedule your annual examinations and request screenings. So asking your doctor about screening for kidney disease, screening for cholesterol, screening for blood pressure. That all reduces your risk for complications. And then we look at monitoring. If your doctor has told you that you need to monitor your blood sugars, do you have a monitor? Do you know where to get a monitor or how to get the monitor? Once you start testing your blood sugars, your doctor may determine, okay, well, there's patterns that we see. There's high patterns and there's low patterns. And what do we need to do about it? Another thing I want to say about monitoring is now there's different technology when it comes to monitoring your blood sugars. So we don't all have to use the blood glucose monitor. That's the traditional monitor in which we prick our fingers, because there are some options to use continuous glucose monitors. And if you fit under the criteria for that, perhaps that's a conversation you can have with your doctor too, to make monitoring just a little bit easier. And lastly, there is taking your medications. So if your doctor has prescribed medication for you to take with diabetes, making sure that you take that medication as scheduled, as indicated, so you can make sure that you are reducing those risk of complications. And then what you want to do is you want to know your benefits. So I can't stress this enough. With insurance, and whether it's private insurance, whether it's a Medicare benefit, it's important to know what's covered. So you want to know what medications are covered. Ask your pharmacist, use, your insurance benefits, call that 1-800 number, use your Medicare booklet that you get. Know what diabetes supplies are covered, whether you can get a blood glucose monitor covered or a continuous glucose monitor covered. Knowing what screenings you can get on a routine basis. Can you get a dietitian to be seen? Can you get screened for pre-diabetes and diabetes, and how often? Knowing about diabetes technology. So if you want to get a continuous glucose monitor, or the doctor has suggested you use an insulin pump, for example, knowing what your insurance benefit covers. Learning about specialized orthopedic footwear. If you have problems with neuropathy, so nerve damage in your feet, knowing that you can go see a podiatrist, knowing that you can get screened for that, and maybe there's an opportunity for you to get some protective footwear. Also, it's important to know that you do have an option if you have private insurance or Medicare for diabetes self-management education, and knowing how much, time you have. With Medicare, you get 10 hours once you're diagnosed with diabetes, you get 10 hours of diabetes education, and that's about every 2 years. And so you get the initial education, and then you get about 8 to 9 hours of that group education. And that applies to most private insurance as well. But again, you need to check your specific benefit, because sometimes co-pays come up with private insurance. And then you need to know about special eye exams, when you need to go get screenings done for that. And then if, again, medical nutrition therapy is covered, which is scheduled with a registered dietitian. If you don't have a benefit through Medicare or private insurance, then maybe you have health spending accounts, or you have federal spending accounts that can help pay for these services for diabetes education or diabetes coaching services. And then some education resources, and I will ask Ms. Tellisford to drop some of those resources in the chat. But there's diabetes coaching programs such as my program, Weldon, in which we offer comprehensive diabetes coaching services. And we offer those services one-on-one. Then there's the National Diabetes Prevention Program that's offered through the CDC. And this is a program to help prevent diabetes. So if you've been told you have prediabetes or you have impaired fasting glucose, this is a program that you can look into. And most of these programs are year-long programs in the community. These programs are free programs. And so you can look them up and see if there's one that's near you. And then Medicare Diabetes Prevention Program. Medicare also has some diabetes and prevention programs, and you can go to the Medicare site to find out where those programs are in your area. And then you have hospital-based diabetes education programs and outpatient diabetes education programs. And again, we're all over the United States, and so looking at your specific programs in your area, but these are some resources for you to be able to go directly to. And then resources that I have for you that I've put together is there's some resources that I've developed on curbing the cravings, your guides to snacks. And then cutting through the noise, your guide to diabetes truth. Sometimes with diabetes, we hear a lot of things that are true and that aren't true. And then reversing the risk, mastering pre-diabetes is another guide that I've created. And with that guide actually helps you, if you've been told you have pre-diabetes, work on strategies to stop it moving to type 2 diabetes. So if you'd like to, Ms. Telesford will put that link in the chat. And these are just some free, quick, short resources for you to reference. And then other website resources that I would encourage you to check out related to diabetes is, again, those Medicare, Medicare.gov for you to be able to identify what your benefits are. The CDC, they have great resources and tools for diabetes, as well as the Diabetes Prevention Program. Then the American Diabetes Association has great information. They have healthy recipes and cooking tips for you there. The National Institute of Diabetes and Digestive and Kidney Diseases has a lot of information there for you as well. They have information on type 1 diabetes, type 2 diabetes, and gestational diabetes, all of these organizations. Oh, and I skipped the Endocrine Society. They have great information and great patient engagement information there. And then financial resources. So having diabetes can be expensive. It can be expensive because of the supplies that we use and the medications that we take for diabetes. And so I always tell people, I don't want that to ever be a barrier to you being able to manage your diabetes. So the National Institute in Diabetes and Digestive and Kidney Disease, they have some great resources on their site with financial resources. And some of those financial resources are listed here, but there's charitable groups often in your communities, local health departments and clinics. And then again, they have this financial link that has local resources on the NIDDK's website. And then your drug manufacturers. So a lot of drug companies, they have financial assistance programs. So if you're on drug A or drug B, I would encourage you to know the manufacturer of that drug so you can go on that website and you can go to the financial assistance program to see how you may be able to save on that particular medication. Because I don't want you to be without medication, because I want you to be able to manage your condition that you have. And so some of those resources, Ms. Telesford will be putting those in the chat. So what are the next steps? So I have their action changes things. You can't see it all there, but that's what it says in that little circle up there at the top. So I always tell people you have to take action. So you heard this, and I could talk about diabetes all day, but this was a simplified steps for success for you. But these next steps is seek support. So get support from health professionals. So if you've been told you have diabetes or pre-diabetes, reach out to qualified health professionals that can assist you. The second thing I want you to do is create a plan. I want you to develop a personal health plan according to what your needs are and your goals. So what's important to you for you to do. The third thing I want you to do is I want you to start gradually and take small steps towards your personal goals. So I always tell people we can't change everything at once. So pick one thing that you are committed to changing and focus on that one thing. The other things will come, but focus on that one thing. So take a small step towards that. And then when you reach success, give yourself a hand clap and let's move to the next thing. Then the last thing there is I want you to do is I want you to monitor your progress. So that's important. Tracking your progress and adjusting your plan as needed. And with monitoring your progress, I always like to tell people you celebrate your wins. So celebrate yourself when you do something good. Even if you just start at step one and you seek support, that's a win. And you've monitored, hey, you're tracking your progress. If you said, I want to make a goal and I want to make an appointment with a doctor because I was identified as having a risk, then that's great because what you did is we're going to celebrate you because you took some action. You took the first step. So then I have a slide here. If you want to get in touch with us at Weldom, this is the information, the email, the phone number, and Weldom's website. And then the last slide here, other resources for you. This is Weldom's YouTube channel. And if you scan that QR code or if you go there, you can subscribe. And each week there's a different video related to the topic of diabetes that you can listen to. And it's topics from winter wellness and weather all the way to snacking and curbing your cravings. And so I think I have finished my slides and I see a lot of activity in the chat. And so, Ms. Telesford, I am going to turn it back over to you to ask me any questions that you have, okay?
Hi, Keisha, and thank you. Thank you very much for joining us this afternoon and for your thoughtful presentation. Before we jump into questions, I want to remind our audience to please participate in our survey. We'd love to hear from you, love to know what you thought about this presentation, and also would like to know from you um, what other what other topics you'd like for us to cover. So, looking at the chat, excuse me. The first question asks, "How will you know if you have impaired fasting diabetes?"
So, impaired fasting glucose or pre-diabetes, it's not a diagnosis of diabetes. It's a impairment. Remember, if I go back to that slide, it's a condition in which your blood sugars are elevated, but they're not high enough to be diabetes. And so with that, I'm gonna escape my slide deck and I'm gonna go back if I can to that slide to be able to show you all what those numbers are. Because as I always say, it's important for you to know your numbers, okay? So I am going to share this slide again. Right here. So this slide. So if you go to the doctor and you have identified, okay, I may be at risk. If your doctor does blood work, remember that fasting blood sugar, if you get it done and you have prediabetes, it'll be between 100 and 125. And if the doctor does an A1C test on you, it'll be between 5.7 and 6.4%. So the only way you'll know if you have prediabetes or impaired fasting glucose is that if you actually get one of these lab tests done, okay?
Okay, thank you very much, Keisha.
Thank you.
Um, Thank you. The next question asks, "Can type 2 diabetes, be reversed?"
So I love that question. So we see a lot of stuff out on the news and probably on the internet about reversing type 2 diabetes. And so the American Diabetes Association, they use the term remission instead of reverse. And I would agree with that term remission and not reverse because what we do when we manage our diabetes or manage our blood sugars, we get them to a level or a range in which they're managed. And yes, those numbers may go down a little bit lower than the definition of the diagnosis of diabetes. But what we did was we changed lifestyle habits. We practiced healthy eating, we were exercising, we were taking medication. And so what we did was we managed it. And so I always tell people, it can go in remission because you did such a good job managing it. But if you stop doing what you were doing and you go back to eating how you were before, or you stop exercising, or you stop taking your medication, then those risks are going to go back up and your numbers are going to go back up over time. So we like to use the word remission, and you can manage it so good that those numbers do go low beyond the threshold of being diagnosed as diabetes.
Okay. Thank you.
Thank you.
Thank you. The next question in our chat reads, I was a type 2 diabetic for around a decade before my blood work came back. That my body was no longer making insulin and my pancreas is mostly not functioning. Is this common?
So I wouldn't, so everyone is a little bit different. And so with some people, um, over time, they receive the diagnosis of type 2 diabetes. Um, and then what we find later through further tests is what your doctor did. They determined that your body was no longer producing insulin. So it's a special test that the doctor did to test your insulin and your autoantibodies in your body. And so at that time, they determined, okay, your pancreas was no longer producing insulin. And so you had the diagnosis then of type 1 diabetes. In some people, we find we have a different type of diabetes. It's called latent onset in adulthood with diabetes. And so I would say, because I don't know, I can't give you a percentage about how the percentage of times that happens, and I wouldn't say that it's common, but that does happen in some people in which they get the diagnosis of type 2 and then we find out they have type 1 because they're not responding to the treatment for type 2 diabetes, and the doctor does these specialized tests in which they look at your autoantibodies.
Okay. Thank you very much. Um, Another question, Keisha, fact or myth? Can we eat as much sugar-free food as we want?
No, that is a myth. So I always tell people, and this is a good reason to seek out education and support from the registered dietitian or the certified diabetes educator. Just because a food is sugar-free, it doesn't mean that it's carbohydrate-free. And with diabetes, carbohydrates, they are the factor that cause our blood sugars to be increased. But I don't want you to think that carbohydrates are bad, because they're not, and we need them. But if you turn something over, if you have a sugar-free product at home and you turn it over and look at it, it's still going to have carbohydrates in it. So we cannot eat endless amounts of sugar-free products. And the other reason we can't eat endless amounts of sugar-free products mostly have what we call sugar alcohols because they've used a sugar substitute. And those sugar alcohols, if we eat too much of them in many people, then they upset your stomach. So please don't eat as much sugar-free products as you can.
Okay. Thank you for that. And then our next question asks, are there any physical signs of diabetes?
Yeah, so some of the things that we talked about earlier in the slide, some of the symptoms you might get is frequent urination, frequent thirst, extreme hunger, rapid weight loss is actually one. And so these are some of the things you might experience, but remember I said you may not experience these symptoms at all because some people don't. So again, if you didn't get a chance to do the 60-second risk test, I want you to go back and do the 60-second risk test and identify your risk, and then talk to your doctor about whether you should be screened. And remember, if you're over the age of 45, you should receive a screening for prediabetes or diabetes.
And that screening should occur annually.
That screening should occur annually.
Okay. And if our doctor doesn't offer that to us, we can ask our doctor or healthcare provider.
We can ask them, and if they say, hey, you did it at your last physical last year and you have no other risk factors, then they might suggest that 3-year interval. But you can request that from your doctor. I'd like to have my fasting blood sugar done, or I'd like to have my hemoglobin A1C done. And especially if you have a risk of diabetes in your family, if you have a strong genetic risk, you should be screened.
Okay. And then to build on that, when you speak to strong genetic risk, is that my mom, my dad, my siblings?
It could be your mom and your dad. So we always say you have a first degree relative that has a history of diabetes. So mom, dad, if you have children, it could be mother, father, and your child is at risk. So it's that first degree relative, grandmother, grandfather as well.
Okay. And then the next question asks, can you please explain A1C levels in layman's term?
All right, I sure can. Thank you. So your hemoglobin A1C, it's a blood test, and that blood test measures the amount of sugar attached to your red blood cells over a 90-day period of time. And that's significant because our red blood cells, they recycle themselves every 90 days. And so the doctor takes that blood test to determine your risk factors for diabetes. And so if that number, remember I was telling you, if it was between 5.7 and 6.4, then that means you have prediabetes. Once it hits 6.5 or higher, then that diagnoses you as having diabetes. So it's a measure of blood because it's a blood test that the doctor will take to determine if you have diabetes.
Okay.
So let
And
me know if I answered it.
I think you did, and thank you
Okay.
very much. It was very thorough. The next question asks, can you expand a little bit about stress? How do
Okay.
I manage my stressors to not exacerbate my diabetes?
So that can be a challenging one that I would say working with someone can help you. But we all have stress. We have good stress, we have bad stress every day. And when we're stressed under, I'd say bad stress, when we're experiencing stress, our body releases certain hormones. And these hormones can affect our blood sugars and make our blood sugars higher. So I always tell individuals, find ways for you to reduce stress. And that can be hard because you're like, hey, I've never had to do this before. So is it taking self-care, taking time for yourself, doing something that you enjoy, going on a walk, talking to a friend or a family member that you feel that understands and that gets you? Um, and beyond that, if you're feeling really stressed and it's affecting your sleep and it's affecting your abilities to cope every day, then talking to your medical team, your doctor, because maybe you need medication to help you manage that. Or maybe you need a counselor to be able to talk to help you through some of those strategies. So, and then I always say there's apps online for mindfulness and relaxation, helping you calm down, and you can even look up some of those various apps.
Okay. And just to build on something you spoke, when you spoke to exercise, does that mean 30 minutes of rigorous aerobics, weightlifting? I mean, or can we, you spoke to taking a walk. That's okay.
Taking a walk is okay. Um, I always tell people just start with walking. And the one thing that I didn't say on my slides, because I didn't go into exercise a whole lot, but if you aren't used to exercising, you haven't been exercising, I don't want anyone to go out there and just start exercising. I want you to have a conversation with your doctor to make sure that you're okay to start walking, that you're okay to start exercising. And recently, I know it's cold, and it's cold, it seems like it's cold everywhere. But recently, and I had my mother do this, and I shared this with my aunt. But you can go on YouTube and you can find a walking video. And if you can't get outside your house to walk, you can walk inside your house. You can put on that YouTube video. You can get you a walking mat, or you can find someplace comfortable in your house and you can walk, you can move. You can do Zumba, you can dance, you can clean your house. Those are all forms of physical activity that you can engage in. But the most important thing I want you to do is I want you to move, because you don't have to join a gym. I'm not a member of a gym. I exercise in my house on at least 3 to 5 mornings a week in my front room, and I don't join a gym. So you find something that you enjoy doing and move.
Okay. And I want to second those YouTube videos.
They
they
work.
they work. Okay. Our next question asks, how does sleep factor into managing blood glucose?
So sleep does impact blood sugar. So if you're not getting proper sleep, you may find that your blood sugars are elevated in the morning when you wake up. Because similar to stress, when we sleep, our body releases different hormones, and these hormones can impact our blood sugars. So it's important. This year, every year, the American Diabetes Association, they put out their standards of care. And we just received our 2025 standards of care. And this year, for the first time, they factor in sleep as being a very important part of diabetes self-management. So you have to get proper sleep to allow your body to rest and recover, and to be able to make sure your blood sugars are well managed.
Okay. And just so we know, what is proper sleep?
Well, so it's a little bit different for everybody, but for most people, we see anywhere from 6 to 8 hours of sleep is what I would say would be proper sleep. Some people, and there's been studies, when you get too much sleep, you're more at risk for heart disease. If you don't get enough sleep, you're more at risk for other conditions too. But somewhere between that 6 and 8 hour time frame, and it may change as you age. So I always tell people what's right for you may not be right for the next person. But there are some specific standards on sleep, but we're going to range within that. My suggestion or recommendation is somewhere between that 6 to 8 hour mark.
Okay. And thank you. Our next question asks about elevated blood sugar and orange juice. Is that still a recommendation from the Diabetes Association to bring down elevated
So
blood?
that is not a recommendation to bring down blood sugars. However, that is a recommendation to help you bring up your blood sugars. So let's say you have a hypoglycemic event, which is also known as a low blood sugar. A low blood sugar happens when your blood sugars reach less than 70, okay, in adults, I'm going to say, in non-pregnant women. In pregnant women, it's less than 60. But if your blood sugar reaches less than 70 and you're having a low blood sugar, you might feel some various symptoms. The treatment for that we still recommend is 15 grams of carbohydrate, which would be about 4 ounces of juice. Okay. And you have that orange juice if you're not on certain medications, because some medications you can't have those citric juices. But you have a half a cup of orange juice, you wait 15 minutes, and then you test your blood sugar. If your blood sugar is not above 70, then you have another half a cup of orange juice. You wait another 15 minutes and you test it again. So that's orange juice, soda, or milk is to be used as a treatment for a low blood sugar. If your blood sugars are high, I definitely don't want you drinking orange juice, because orange juice has increased carbohydrates. So for high treatment, I mean, drink some water, it'll help, but that's not really the message that I want to relay about high blood sugars. But no, so I hope that answered the question. The orange juice recommendation is treatment of a low blood sugar, okay?
Okay. And we have just about 2 minutes, and I want to respect your time, Keisha, and our audience's time. So we have just enough time for two questions, if that's okay with you and the audience. You spoke to water. So, what role does water play into managing our blood sugars?
So water can be a good thing. I tell people I don't want you to use this as a treatment, but if you have eaten a little bit too much and your blood sugars are a little bit higher and you drink some water, that can help. with flushing some of that extra sugar out. But in general, water should be used because we all need hydration. I have my water cup right here next to me. So water is important throughout the day for hydration, to help our body stay hydrated, to help us digest more, to help us have good bowel movements. Water is just good for that. But in the role of diabetes, I'm going to say, I'm not going to tell you, hey, water is going to be a magic cure, but water is good for all of us to be drinking.
Okay. And as we close out our webinar here, you mentioned that it's been cold recently. And so our last question asks, can diabetes reduce temperature sensitivity?
So, and can diabetes reduce temperature sensitivity? So I'm going to say if you have some type of neuropathy, a nerve problem, and it's cold outside, and you've had some nerve damage because of diabetes, it could affect the way you are able to determine cold temperatures or hot temperatures. And I think that might be what you might be asking, Mr. Graham. So let me know. And then I'm just gonna say this one thing too, with the weather, hot and cold weather can also actually affect blood sugar levels. And so sometimes when it's, cold outside, the way our blood restricts, it can impact our blood glucose numbers. But I think I'm at time now.
Yes, but I want to thank you for such a thoughtful presentation. Thank you for answering all of our questions. To our audience, thank you for those wonderful questions and for participating. And we appreciate you taking just a few minutes to respond to the survey. We look forward to your input. And thank you again. Thank you, Keisha, for joining us. And we'd like to wish everyone a good afternoon.
Thank you.
Thank you.
Bye-bye.
Bye.